how would a decision be made to start trying to deflate a cuff on a tracheostomy?
Okay. So I think our attitude here, because we're that sort of middle stage between post-acute and long-term care, I think we have that sort of ethos of we try as hard as we can for most patients to see whether we can wean their trachees, because it's hugely beneficial to not be discharged with a big piece of plastic. For many reasons, you don't want it there as an infection risk, it's something else to manage, but also sometimes it means that people can be placed more closely to families, because if they are going to a specialist nursing home, there may not be one near their family, but if they don't have that trachea, then that opens up a wider choice for them. Yeah. So actually, for most patients who come in with a trachea, it will be, we have a team meeting once a week, and it will be, as part of that team meeting, we talk about the tracheostomy management. So it's always in the back of our minds, is this a patient that we're going to wean? So there's always a discussion, is this an appropriate patient? And we would look at whether they're managing their saliva, whether they're trying to mouth, or is there any function that they're showing us that we might want to sort of tap into by taking the cuff down. And we would probably, the first thing we would do when they're well seated, haven't got a chest infection, they're medically stable, is that we would give it a go. Usually it's a SLT and a physio who do an initial session. We try the cuff down and we just see what happens. We see whether the sats are maintained. We see whether taking the cuff down aids with saliva management by increasing sensation, so maybe increasing swallow frequency or ability to cough and clear saliva. So we just basically try, and then we go from there. And if they fail, we might look a bit further with the fees and see why they're failing. Is it saliva? It might be that they've become quite hypersensitive to having airflow when they haven't had it for a while, so we might look at gradually increasing times with the cuff down, and we'd go from there after that initial deflation.